Hello and welcome to this recorded demonstration of the Canadian Cerner Reference Model, or CCRM. I'm John Drover, Physician Lead for the Lumio project. This is a fast-paced 30-minute demonstration of what the model is, and will show how it works from front end to back end, admission to discharge. The thing to keep in mind is that the Canadian Cerner Reference Model is the foundational building blocks. It's like buying the plans to a house. And now we need to do some further design, deciding what color the rooms are and where the cupboards go. The workshops that are currently underway are helping to build that system so that it meets our needs in the southeast. And so what you'll see is the beginnings of that. And I hope that this will be helpful in terms of seeing how the system will work, although the details are not finally built out yet. The workshops that are underway will build the system and will be finalized towards the end of April 2023. And then we will start various things in terms of testing and training that will finalize the system. I hope you enjoy the show.
Welcome to the Oracle Cerner presentation of the CCRM demonstration of Lumio Antonelli's healthcare journey. My name is Adrian Miller, and together with Sarah Grin, we'll be presenting this demonstration to you, and we'll be getting to that in just a moment. I have a few slides that I'd like to go over before we get started. And first is a forward-looking statement. This is a slide that's required from us from Oracle Cerner to have in all of our presentations. This is really related to statements related to Oracle Cerner's future plans, expectations, beliefs, intentions, and prospects. However, we won't be discussing any of that within this presentation, so we can skip right over that. I would like to call your attention to the CCRM impact statement. And again, CCRM stands for the Cerner Canadian Reference Model. This provides the basis for the Lumio domain build. And what that means is that images within this presentation may not be the same as they will be in the final state of the build. So please keep that in mind as you see these images, and also keep in mind we're not able to show every single aspect of clinical or health care, but you will be able to imagine yourself within some of the situations and scenarios that we present today. With that, let's get started. I present to you 56-year-old Lumio Antonelli, who was involved in a car accident on the 401. He's registered to the emergency department where he's met by his wife, Maria. He's then admitted to general surgery where he undergoes a reparative operation on his hip, and he's then admitted to an inpatient unit. Once stable, he's discharged to follow up with outpatient rehab clinical care, where after that, he enjoys the rest of his life with his wife, Maria. We'll begin with emergency room nurse Jennifer, who will be completing the pre-arrival of the patient before he arrives to the hospital. On this screen, you can see the layout of Launch Point, where all of our patients' information can be seen. And I'll walk you through what that looks like as we arrive the patient and document on Lumio. But for now, Nurse Jennifer is going to go over to the blue person with the blue cross next to the head. She's going to select Add Pre-Arrival. And as she's receiving the call from EMS, she can document the most pertinent details that they provide. So right now, they're not sure of this person's name. He's unconscious. He was just involved in this car accident, and they haven't located any of his ID. So she documents the vital signs that are provided, that he will arrive through ground transportation, that he's the male driver of a vehicle and was unrestrained. From there, Nurse Jennifer selects OK, and then we can see pre-arrival, which is the first name that she gave to him, and last name Lumio show on Launch Point with pre-arrival on the left. We can see what he's coming for. There's no other information that displays because this is not a part of the chart just yet. And all the way to the right, we can see that the pre-arrival is listed and the ETA is 20 minutes. From here, we'll go to our registration clerk, Mark, who will be completing the quick registration when our unconscious patient arrives. So this is the registration view of LaunchPoint. Mark can see all of the patients that are currently in the ED. And now that our patient has arrived to the emergency department, Mark can select this quick registration, which is the yellow piece of paper on the top left. Selecting that allows Mark to search for Mr. Antonelli's name. EMS eventually did locate his ID in his pocket, and Mark can then search and select the patient that he needs. You can see within the registration screen, Mark, our registration clerk, has several yellow fields, and you'll see this consistent within Cerner, and this indicates that these fields are required. Once they're actually completed, we still can denote that these were once required because there's a red asterisk next to these fields within the registration screen. So Mark's filled out Mr. Antonelli's most pertinent details that he needs to complete the quick registration. He can then select OK so that care can be delivered pretty quickly after his arrival. On the next screen, we see that Mr. Antonelli's information displays, and this confirms that he's been quick registered by Mark. He receives his community medical record number and his MRN, which are consistent throughout all of his visits to any Lumio organization. His encounter number and visit ID change within each encounter and each visit that he has with each facility. On this screen, we can see that the pre-arrival is separate from the actual electronic health record. So what Mark will do, and I'll skip through these steps, is attach the pre-arrival to Mr. Antonelli's chart. That makes it available for viewing later on in our care, and we'll walk you through what that looks like a little bit later on. But next, we'll go back to Nurse Jennifer, who completes her triage assessment on a power form, as well as her CTAS score. So now that Mr. Antonelli has been quick registered, Nurse Jennifer can see him on her LaunchPoint. She sees that he's come for a car accident, and she also knows that the pre-arrival has been attached. She can see here that triage is needed. So what she'll do is select the white space under Mr. Antonelli's name. It opens the EC task component, which then allows her to go to the triage assessment. Opening the triage assessment, it's like a spreadsheet of sorts where you can select each tab and move between each of them as needed. But Nurse Jennifer is going to stay right on the general page. And again, we see our yellow fields, which denote, again, required data. So under infection control screening, Mr. Antonelli is still unconscious. So Nurse Jennifer is going to defer because he's medically unstable. She'll select that, and then she'll also fill out the rest of his information, which includes the pre-arrival interventions. As she's speaking with EMS after they bring Mr. Antonelli to the ED, she can select that he had assisted ventilation, bag, valve, and mask, his cervical collar, and he was also backboarded along the way. Selecting this back arrow brings her back to the main page where she can scroll down and address the rest of the required fields. She can select unable to assess for his pain assessment, as well as under medical history, she can select unable to obtain for both of those required areas. Everything else she can complete as required for Mr. Antonelli and giving him the fastest care possible. So she'll also include his weight, which is 80 kilograms and estimated, and this allows the rest of our clinicians, like our physicians, to place orders without getting bogged down with the request for an actual weight. And she can always complete an actual weight as it's obtained later in his visit. From there, Nurse Jennifer signs that form, and she can now fill out the CEDAS complaint. She'll be selecting head injury as a part of the MVA, and all of these fields here that you see are auto-populated. That means that they pull forward from the previous documentation that was shown. So moderate respiratory distress is the highest level of modifier that correlates to Mr. Antonelli's documentation. And it pulls there because his heart rate was elevated, respiratory rate was also elevated, and O2 saturation was low. So now Nurse Jennifer can have the system calculate the CTAS score, which shows as a 2. Then she'll select to submit the score. From there, we see that Mr. Antonelli's information updates on LaunchPoint. He's has an acuity level of 2. You can see that he's still there for the head injury, his vital signs and his weight display as well for everyone who has access to LaunchPoint, including our physician and other clinicians. And we see that triage has been completed. Next, we'll go to Dr. Bryson, who places the trauma order set. Again, Dr. Bryson will see the same information on LaunchPoint that Nurse Jennifer saw. So this really helps with the integration and with shared communication. First, Dr. Bryson is going to go to the new order entry component within the ED workflow page. This is just like the Power Form where Dr. Bryson can navigate to any of these sections she wants to at any time, but it's placed within an order that helps support her workflow. So she will type in trauma as a new order, and anything with the word trauma in it will display. She'll then select the ED trauma order set, which allows her to quickly place several orders. This is a quick win for many of our providers because without it, they'd have to individually select each one of these orders. So as we look at the middle of the screen, you can see that within the order set, there are sections that denote the areas of care that each order correlates with. So patient care, vital signs, activity, and you can see that many of these are pre-selected. So again, this is a great time saver for our physicians. Under IV bolus, Dr. Bryson will select the 0.9 for Mr. Antonelli, and then she'll scroll down the screen a bit where we see medications categorized as well for ease of viewing. Finally, Dr. Bryson will go down to labs, and this is actually a nested order set. ED lab trauma lives within the trauma order set, and that allows Dr. Bryson to place at about 27 labs by selecting this one order in this order set. These details might change as decisions are made within the Lumio workshops, but as we've mentioned, this is our CCRM base build, and currently these are the pre-selected items that live within the trauma order set. As Dr. Bryson scrolls down a bit further, we can see that there's a chest x-ray order, and I'd like to call out a special functionality that's really helpful for our clinicians here, and that is this white piece of paper. And if I click on that, it opens reference text. Within this reference text and within any order, we can have guidance that can be used for our nurses, our clinicians. We can place patient information, policies, and procedures. This is a great way to share information and help guide care and have just-in-time information at our clinicians' fingertips. From here, I'll select OK. And now that Dr. Bryson has completed all of the orders that she needs, she'll sign her order set, and that completes that section. Now our registration clerk, Mark, can complete the full registration of Mr. Antonelli, which allows for appropriate coding. And as Mr. Antonelli goes through his journey in healthcare, he can receive care seamlessly and have his documentation and information accurately coded. So Mark can see the yellow key here that lets him know that Mr. Antonelli's full registration has not yet been completed. And Mark will navigate over to the top left again of his screen and go to the key that will allow him to complete that full registration. Within the screen again, we can see that the previous details that Mark filled out regarding Mr. Antonelli are still there. His health card displays as yellow, which prompts Mark to validate that this is the correct information. And a little bit further below, we can see all of these tabs that Mark can navigate between. He'll now fill out his marital status of Mr. Antonelli, his preferred language, his primary care provider, and he could even fill out his religion. Next, we'll go to the patient address tab, where Mark can fill out those details. Going a bit further, under encounter information, we see that Mr. Antonelli is located in the emergency department, and as his care shifts and he moves throughout the hospital, Mark can update this information as needed so that everyone can see exactly where Mr. Antonelli is within our organization. Finally, Mark can complete his Mr. Antonelli's wife's information, Maria, and he can also fill out any additional contact information that might be needed for Mr. Antonelli's stay. And that way he has, the hospital staff has full access to his contacts and can receive additional information as needed. Now that that's complete, Mark selects OK, and we see on his screen that the yellow key has disappeared, which lets him know that the full registration has been completed. Next, we'll move back to Nurse Jennifer, who is simultaneously completing Dr. Bryson's orders. So on launch point, Nurse Jennifer sees that there's 4 medication orders. We'll just be focused on a few and a couple of other details that Nurse Jennifer will be documenting. She'll navigate within Mr. Antonelli's chart directly into iView, which is where our nurses complete the majority of their documentation. iView has several sections, such as adult systems assessments, which is where the scales and assessments is located. And then we have our lines and devices. Nurse Jennifer will be here documenting on the urinary catheter. She'll select this grid, and that will allow her to label the catheter with the appropriate information. She'll select urethral, indwelling, and a 14 French. After that's complete, she'll select OK, and then she'll double click within the blue banner bar here, and that will allow all of these sections within this area to automatically open. So she can hit the tab button and easily document the areas that she's looking for. She'll be selecting chronic indwelling catheter under indications. For activity, it will be inserting a new catheter. And we'll just skip through her documenting the tubing start date and current date. I will draw your attention to the tubing total days, which is an automatic calculation based on the start date and current date. As our nurses and clinicians document on this catheter, though the total tubing days will automatically calculate, which is really important for infection control and preventing nosocomial infections as well. Next, Nurse Jennifer will select the green check mark, which allows her to sign that documentation, and it goes from purple to black, which lets her know that that documentation has indeed been completed. From here, Nurse Jennifer can scan Mr. Antonelli's wristband, which allows her to document her 0.9 bolus. After doing that, she can scan the 0.9, which then opens this window. She can document the details of the medication administration, such as the left arm being the correct site, total volume being 1,000 milliliters, and also who it was performed by if it wasn't her and she was documenting by proxy, say after a downtime. She can also update the infused overtime, as well as any other details here. And once this information is complete, she can again select the green check mark and sign her documentation. That completes her 0.9 administration. And we can go back to Dr. Bryson, who will place her consult and complete her note. So Dr. Bryson again will open Mr. Antonelli's chart. And again, within her ED workflow, she'll be completing her note here under history of present illness. We can see that she documents the patient presents unconscious post-automobile accident unrestrained. And under review of systems, she can select auto text or dot phrase. So all she has to type is .ro, and we can see that all the .ro statements display. She'll be selecting .ros complete, and that pulls in the auto text for review of systems that she would like to have on the chart. Within this frame of text, she can update any information from being negative, such as no fevers and chills and sweats, to being positive, such as in genitourinary, where she can select Mr. Antonelli being positive for hematuria. From here, she'll save and scroll down to histories, where she can see that Nurse Jennifer documented high cholesterol, hypertension, and she can also see that the pre-arrival that we showed earlier that is not a part of the EHR has been added to it, and she could open this documentation and see the information there if she wanted. Dr. Bryson can also go to the ED triage notes, as well as any registration information that displays there. Once Dr. Bryson has reviewed all of her information, she can open her note, complete it, complete the physical exam, as well as the impressions, and she'll state that Mr. Antonelli will be admitted for surgery. And we can see here the green check mark on the right of her launch point, which shows that her notes and documentation have been completed. Next, we'll go to Dr. Samus, who's our general surgeon, and he will admit Mr. Antonelli for surgery. We can see Mr. Antonelli here on Dr. Samus's patient list. And once in his chart, we can see the familiar view of the provider workflow end page. It's now the inpatient workflow instead of ED workflow. And again, Dr. Samus will go to new order entry, where he will enter the patient admission orders, or the PAO. From there, he can modify details or sign. Dr. Samus will then ensure that Mr. Antonelli is admitted to inpatient, and there he can sign that order, as well as place the procedure information such as hip abductor repair and any other procedures necessary. That brings us to the OR room, the OR nurse, Rhonda, who can now, after Mr. Antonelli has consented to his procedure, complete her perioperative checklist. She's also done her own assessment of Mr. Antonelli, documented his vitals, and at this point, she'll make sure that she can double click in the yes column, which quickly fills out all of the information within the perioperative checklist. If any of these items didn't pertain to Mr. Antonelli, were no or an NA, she could change those. But for the purposes of this presentation, everything relates to Mr. Antonelli. So Nurse Rhonda can now sign her orders. That makes him ready for anesthesiologist Josie, who will be taking care of him in the OR. Anesthesiologist Josie will review Mr. Antonelli's information, ensure that it is correct. Now that she's verified the case, she can select the green check mark. This brings her to a macro within our surgical area. This is much like an order set where we have pre-selected items. We can see that under the column of execute. We can also see them pre-selected under to do. And these are based on the pertinent procedure that has been selected for the case. Once anesthesiologist Josie confirms that she has the right information pre-selected, she can execute, and this will allow her to select start for her start time, which we can see is 10:14, and all of these start times correlate to the times that you see across your screen at the top. If this were a live demonstration, we would see the yellow bar moving across our field as time progressed, but for the purposes of this presentation, it will not be moving. So as anesthesiologist Josie completes her care and she documents IVs, medications, or anything else, icons will display that correlate with the time they were given. This allows her the ability to pay close attention to how long the case is taking, and can quickly refer to what time any medication was administered, which is very crucial in the operating room setting. From here, anesthesiologist Rosie, once the case is finalized, can sign her information after reviewing it, confirming it was correct and complete. So once she signs, the case is finalized, and Dr. Bryson, Dr. Samus can now move forward with his final documentation. Dr. Samus will place the surgery admission post-op order set. He'll also place some pain control for Mr. Antonelli, as well as consult to physiotherapy. And finally, discontinuing the urinary catheter. From here, Dr. Samus can sign and modify these details, and also review any of the additional documentation that occurred within the OR. Dr. Samus will also finalize his note and place his OR note there and hand over care to our inpatient nurse, Emily.
All right. So our inpatient nurse, Emily, is going to be looking after Mr. Antonelli on the inpatient surgical floor. And what you're seeing here is Care Compass, so a landing page for inpatient nursing. I'm going to go right into Mr. Antonelli's chart and do some chart review, document my handover, and initiate some orders. So you can see here along the side that I'm in my handoff M page. And the key information that I need to know as a nurse at handoff is going to be here. And whether I'm looking at this at the same time as the PACU nurse bringing the patient up on the unit at the bedside, or perhaps I'm doing my handover over the phone, I can be seeing the same information as we have our handover discussion. So I'm going to just look through our problem list, all of the things that came through from the emergency department through the OR, I'm going to be able to see. Looking at orders, intake and output, any sorts of documents. You can see here all of the notes have come through, and I can look at my lines, tubes, and drains, etc. What I'm going to do next is come on over to my iView, and I'm going to come here and document my actual handover. So you can see here that any handovers that have already taken place are documented. So again, that continuation of the record. I'm going to double click here and just chart some key and pertinent details. This is the patient coming from PACU to surgery. It's the nurse that came with him. And I'm going to be indicating some ice. I've looked at his dressings and treatments. I know that I've gotten report. So just some key information as to who I got my information from. I've verified ID bands, looked at his lines, tubes, and catheters, and done the safety checks that are applicable. Also noted that his daughter is here and at the bedside, and I will go ahead and come to my green check mark and file that away so that my handover is complete. Now I'm going to come back over to my orders, and I'm going to initiate these orders that are in a planned state for my surgery admission post-op orders. So I'll right click on here and go ahead and initiate now, and that will start the orders off for the post-op phase of care. All right. And we'll sign that off. Next, we're going to go to what our pharmacist does. So our pharmacist, Jessica, given that this is an inpatient, is going to be reviewing some of these medications. I can see here in the pharmacist view in the pharmacy patient monitor that I have Mr. Antonelli, and I can see his hydromorphone as well as naloxone ordered, but I'm going to review his hydromorphone just by clicking in. And I can see here what I'd like to be able to do is verify that medication. And what we will do is come on over and apply that to what we would like to accomplish. Here I see more information, more details. I can see more information about Mr. Antonelli on the left, so I don't have to be searching through his chart. I have the information that I need at my fingertips. So I'm happy with this hydromorphone as the pharmacist. It's appropriate. I'll go ahead and say okay, and then we'll submit that verification. All right, so that will mean that we go back to our inpatient surgical nurse, Emily. I'm going to review some of these orders. You can see here, I'll go right back into his chart from Care Compass. I know that I need to start to discontinue his urinary catheter. I can change his IV to saline lock. He has some medications that I can give him. So I'm going to do those things. Maybe what we'll do first is come on over to our admission M page, which is giving us the key things that we're going to have to do as the patient is admitted to the inpatient floor. So I can see here as well the home medications from Emerge, which is fantastic. He hasn't had his admission med rec completed yet, so maybe I'll get Dr. Samus to do that. But I'm going to do some admission documentation here and come on over and do my admission history adult. So I'm not going to go through this entire form. This is a little bit familiar probably by now. You can see that it's a power form, and I'm going to go ahead and put some key information in and come on over. Not the primary caregiver for anybody else. I'll come on over to advanced directives here. He doesn't have an advanced directive, but he would want his spouse or partner to make decisions for him. The infectious disease screening and antibiotic resistant organism screening were not done in the emergency department. If they had been, this information would have flowed through to the inpatient, and I could have just reviewed it as the nurse rather than doing it. But at the time the nurse was doing this assessment, Mr. Antonelli was unconscious. So we will do it on the floor. You can see here, if I had answered yes, there's some decision support to tell me when I should be thinking about initiating precautions. In terms of nutrition, the screening here would be negative. When I go into kind of some education and discharge needs, in terms of there will be someone staying with him at the hospital. And I think at this point, I think he'll have to go home with some home care services. So I'm going to indicate that now. This is post-op day 0. That might change by the time he actually goes home, but this will be the plan for now. So we'll start to talk to those parties and think about what services he'll need. I'm going to go ahead and file that, and then we will come on over to our iView. So I talked a little bit about, we could go ahead and discontinue his Foley catheter. He has started to take fluid, so we're going to enter that in. And we're just going to, before we take out his Foley, we'll make sure that we've captured his urine output in I's and O's, and we will go from there. And I will file that away. Then we will come on over, and since we took the Foley catheter out, we can go ahead and indicate that we removed it. It was discontinued because it was no longer needed. I'll do the same for his IVs. I'm going to change them to saline locks. So you can see here, he's got two IVs, an 18 gauge as well as in his right and his left. And I'm going to saline lock both of those for now and then file that. Excellent. So all of that information that was in the emergency department through the OR, I just continue on with his record. All right, this next thing I'd like to do is give him some medication. So I'm going to come over to the MAR and come up here into the gray bar to the medication administration wizard. And I can see here that I can give some hydromorphone. So this is where I'd pick up my scanner and I'd scan the patient's wristband. Then I would proceed to scan the actual medication package, and that would be for the hydromorphone. I get the blue check mark when that product or that medication matches the order as well as the patient. So it's that closed loop medication administration, and I'll go ahead and sign that off. And you can see here that I've completed my medication administration. All right, we're going to transition a little bit to a different healthcare provider, and we're going to see a little bit of what physiotherapy would do. You'll notice that this workflow will also be very similar for potentially occupational therapy, potentially for dietitians, as well as speech and language. So some of the allied health have a very similar, workflow. So I'm going to come into my landing page where I have a multi-patient task list, and I can see here Mr. Antonelli's on my task list. And the purpose of this really is to help you organize your day and help to see what sorts of things need to be done. So the advantage here is that I could go right into Mr. Antonelli's chart and do some chart review before seeing him. What I can also do though is just click on this here, and that will bring me right into the applicable documentation that I need to complete. So I'm going to go ahead and put some key information in. He lives with his family in a house, so we are good there. We're going to, again, there's a lot of information that could go in, but we're going to come on down to this subjective section. And you can see here that not only are there some tick boxes, but there are also opportunities to put in some free text so that you can tell the story or explain what your subjective findings were. I'm going to come on down to the education section and we'll file that away. All right. And you can see here that this is complete. So I am done with that task. And then I have my other things that I need to do throughout the day. All right, we are going to go back to Dr. Samus and we're going to fast forward a little bit. So our patient is 5 or 6 days post-op and he is ready to be discharged. So we will go on into his workflow and we're going to go to his discharge workflow M page. So you can see here red asterisks telling you that you have some things that need to be done before the patient goes. And we're going to go ahead and first we're going to put in a discharge order. And this is going to tell the team that the patient is ready to be discharged. And it's going to mobilize so that they know, and bed allocation can know as well, so that they can start to plan on using that bed for the next patient. I'm going to go ahead and discharge the patient home. And I'm also going to put in a follow-up order so that I have a referral to physio. We'll do that. We'll come up to our order inbox and we'll sign those off. There is one thing that I need to enter here into say that I want rehab in an outpatient setting and that I'd like the reason for referral is because Mr. Antonelli is post-op. I will go ahead and sign. And then we will come on over to our medication reconciliation. So I can see here that this is needed to be done. I'm going to click on our discharge to home medication reconciliation. And I know that I want the patient to continue on his home meds. So here these scrolls are indicating to you that those are his home meds. And these are the medications, the little hospital with the cross in it, that's indicating that those were medications that were ordered in hospital. So I would like the patient to continue with his home meds, and I'll continue with the remaining, but I don't really want any of the other medications, the hydromorphone, the naloxone, to continue. So I'm going to indicate that I do not want to continue remaining orders, and I will sign that off. All right, what I would like to do though is to add a medication so that I can send him home with a prescription. So here you can see that this is a pill bottle. I've prescribed it, and at this point I would indicate where I want that to go, whether I want it to print or go electronically faxed to the community pharmacy. And I will indicate my details and sign that off. Excellent. All right, so you can see here that I have my prescription. Another thing I'd like to be able to do is indicate that I want Mr. Antonelli to follow up with his family doctor in a month. So I've indicated that follow-up with a quick pick, and then I'm going to do some dictation. So I can be doing my documentation as I go along through this discharge workflow. And I'm going to dictate likely into a Dragon mic or potentially into a mobile device, but we'll go ahead and start here in the hospital course. So the patient was brought to hospital emergency department 6 days ago, post MVA, decreased level of consciousness and hip fracture. LOC improved within 1 hour of arrival and surgical repair completed, period, to surgical floor post-operatively with physiotherapy and discharge planning support, period. We'll come on into our assessment and plan, into our trauma section. Plan discussed at rounds this morning with team. Patient no longer requires home care services due to family support. Discharge home with outpatient rehab clinic, period. And we are going to go ahead and come over here and go to our discharge note. At this point, we would be able to add more if we wanted to. We could be using those dot phrases that Adrian showed us. We could be doing more dictation or potentially even free text typing if that's preferable. But I'm happy with what I see here in my note. So I'm going to come and sign and submit it. I could choose at this point if I did want to forward it to additional people, but I will go ahead and sign. And my documentation is complete. You can see that my discharge summary is here. All right, we are going to transition a little bit to what the nurse would be doing at discharge. So we're going to introduce you to their inpatient nurse, Janice. And she is going to, again, she sees here on her care compass that there's a new order. So she's going to click here in the starburst and can see that there's an order to discharge the patient. Now, hopefully there would also be a discussion at rounds so that everybody on the team would know that this was the plan, but the nurse will certainly know here as well to start to prepare the patient and make sure transport is arranged. So we're going to head right on into Mr. Antonelli's chart. And you can see here in the Discharge M page, very similar things, and they've got green check marks because the provider, Dr. Samus, has already done the things that he needs to. The nurse will probably also have some additional discharge documentation, which she'll be able to access here, but I'm going to show the inpatient discharge instructions. So we'll come on over. And what this is meant to be is a patient-friendly, patient and family-friendly summary of some of the things that, some instructions, what they need to do, medications, as well as some key other information such as test results or labs that they had in the hospital. And all of these things will potentially be flowing in from documentation in the chart, or you can also be free text adding in information as you go along. I am happy with what I see here, and I will go ahead and sign and submit. And similarly, I would be able to print this and give the patient a copy, and it would also be saved onto the record. All right, we're going to transition again, and this is probably a little bit of a fast forward to our rehab outpatient clinic. So Richard is also a physiotherapist, and he's going to see Mr. Antonelli. When Richard logs in, he's going to see ambulatory organizer. And this is a way for you to be able to organize your day when you're working in more of an ambulatory setting. So you can see here the date, you can see which patients you're seeing people for. So whether it's a group of providers or even a group of allied staff, or just a single location clinic and you want to see the patients for that clinic, you'll be able to organize that according to what your workflow needs. You can see here that Mr. Antonelli is due to come in. If in advance of his appointment, you do want to go into his chart and look at some information, you can do that. So I'm going to click on his name, and that brings me into his allied health summary. What I really want to do is see some documentation from his previous visit. So I can see the daily documentation that the physiotherapist did. I can be seeing his discharge note. I could also be looking at the discharge instructions to see that the nurse had printed out, to see if there's anything that I need to be reinforcing with Mr. Antonelli or any additional education needs that I might have to address. I'm going to come back to the ambulatory organizer. And when Mr. Antonelli arrives, I'm going to be checking him in. And after I've checked him in, I do my appointment, and then I can go right on into his documentation. So I'm going to go ahead and chart that. And you can see here again, very similar, lots of options along the side here. But I want Mr. Antonelli to have a bit of a plan. I would like some supine range of motion, and then truly some education and circulatory exercises. And I want him to come back. So I could ask the clerk to schedule a follow-up appointment. I'll sign that off. And that brings us to the end of his journey. So you've seen a patient journey through the emergency department to the OR and into the inpatient unit. Then there was follow-up post-discharge with outpatient rehab. Lumio Antonelli benefited from the seamless care and sharing of information across care transitions. We thank you for your attention. And now I will stop the recording. Thank you.